So excited to bring this to the teens that I work with because they're just struggling so much with symptoms that are just not affected at all by like traditional therapy, even though they've been to 3, 4, 5 therapists, hospitalizations, day programs, residential facilities, and they're just losing hope in themselves, and their parents are confused and their families are confused, and they have these diagnoses like, you know, borderline personality, like bipolar disorder, severe chronic depression, like treatment resistant. And when I get to know these kids, they've just been through really awful things and nobody is targeting that. We're treating like the present symptoms instead of the root cause. And I feel like this is something that gets to the root cause, because I think sometimes mental health stuff, diagnoses really cover up trauma. And people forget that they've been through awful things, and then suddenly it's like, why am I depressed? Why am I anxious? Why am I having flashbacks? Oh, that's right, I've been through really terrible things, but I don't know what to do about it because it was 10 years ago, so there's no way it can be affecting me anymore. When really it's like, this is it, like this is how it's affecting you, and this is a way that you can like process it and go through it. Even with little kids, it's like, well, you're 5, but there's a way that you can like get this stuff out so it's not stuck in your brain anymore. Or even with teens who, I don't know, I've always been sad, or I don't know, I've always been anxious. Well, there's probably a reason. You're not meant to be like this. You're not meant to hurt yourself all the time. Like, let's explore that and process it and get you through it. I never took a trauma course, so I feel like so many people should learn about the instinctual trauma response model, because almost every teenager that I'm coming into contact with in the day program that I work in, there's a trauma there. There's some kind of trauma. But, you know, as a therapist, especially in a short-term setting, it's like, I have 6 weeks to work with this kid and maybe I'll never see them again after that. So what can I possibly do? And the ITR model can absolutely fit perfectly into that 6-week model to at least address really important traumas for them, to eventually help them move on to once weekly outpatient therapy and like really learn about themselves and get over the really intense like chronic symptoms so they can do the work further. And I think if we treat the trauma and see what's left, I think that would be amazing for them to not like get stuck in that identity of, well, I just have schizophrenia, or I'm just, you know, borderline, or I'm just someone with bipolar disorder, and that's it. Because they start to like identify with their diagnosis when they're not that. It's just something that happened to them. What I do love about this is that it does allow me to continue to be the compassionate person and therapist that I am, instead of just following a really regimented step-by-step, you know, process with the client, because we have to model being compassionate and we have to model being kind and like the true self. So I don't have to, you know, leave behind or forget about a part of myself as I'm helping a client kind of like go through this process.